Medication administration. Quality Living Solutions DSP training. Many of the people you support take at least one or more medications on a daily basis. Everyone you support will need to take medications at some time or another as their medical status changes. Medication administration is a high-risk activity. You will learn critical skills which are designed to increase safety and reduce the risk of error. This will help to maximize protection for the individuals you assist as well as yourself. No one wants to be responsible for causing injury or harm to someone else. As you will see, administering medications is a very important responsibility and there are many risks. This is why it is so important to follow the physician's orders exactly. Safety is key to preventing medication errors. Responsibilities before administering medications. Read the medication order. Prepare the medication for administration. Use the proper equipment. Prepare the medication accurately. Responsibilities during the administration of medications. Identify the individual. Explain the procedure to the individual. Administer the medication correctly. Responsibilities following administration of medications. Record the administration of the medication. Clean the equipment. Observe and record the effects of the medication. Record and report the adverse effects or poor response to the medication. Charts and MARS. Provide medical picture of the individual. Confidential. Should be accurate, readable picture of the individual's care. Legal record that is admissible evidence in legal action. Legibility is very important. Write or print that can be read by others. Use blue or black ink. Never erase or obliterate an entry. Your signature means that you assume responsibility for the entry. Negligence and malpractice. Negligence is the omission or neglect of any reasonable precaution, care or action. Malpractice is any improper or injurious practice, or any unskilled or faulty medical treatment. Staff is obligated to perform care that meets minimum standards. Staff is negligent if reasonable care is not given or if unreasonable care is given. Avoid being negligent. Do only things you have been trained to do. Observe the legal rights of every individual. Complete all records carefully. Keep informed about the medications including their actions and adverse effects. Follow the agency policies. Examples of negligence include leaving a dependent individual unattended in a shower or bath, giving the wrong medication to an individual, failing to report an observation or adverse effect to appropriate personnel that later has profound consequences for the individual's health, causing an injury by using defective/broken equipment or supplies, failing to give medication at the prescribed time. Preparing and administering medications. Medication sheets, medication logs or MR, medication administration records, are used to record each individual's medication. Medication should always be checked 3 times prior to administration. Compare the medication to the order before you pour it. Compare the medication to the order after you pour it. Compare the medication to the order before you administer it. Using med sheets as a preparation and administration guide enables the staff to chart immediately. Charting must be done as soon as the medication is given. Never chart until after you have given the medication. General considerations: wash hands. Good lighting, have appropriate eyewear if needed. Work alone and avoid distractions/interruptions. Do not leave medication unattended. Read the label 3 times. Make sure the information on the med sheet corresponds exactly to the label on the individual's meds. Medications can be given within 12 hours of the prescribed time. Never borrow medication from one individual to give to another. Check the expiration date. Never return an unused dose of medication to the container. Always remember to complete appropriate documentation. Safety precautions to prevent errors. Identify the person. Remain with the individual while she swallows the medication. Do not leave medication for the individual to take later. Always check the medication sheets. Medication must be given by the person who prepares it. If individual expresses doubt or concern, listen to them, they could be correct. Omitted or refused drugs. Omission, missed, drug should be reported as soon as it's discovered. It will be determined if the dose should still be given. Drugs may be omitted for legitimate reasons. Suspected allergy. NPO for diagnostic test. Inability to swallow the medication. Certain heart medications. Pulse below 60. Individual has been drinking, appears under the influence. Refusal. Individuals have the right to refuse medications. If refusal is due to nausea or other possible adverse effect, contact supervisor. Always explain why it's important that the medication is taken. Individual should be advised of the medical consequences of medication refusal. The 6 rights of medication administration. 1. Give the right medication. 2. Give the right dose. 3. Give medication to the right individual. 4. Give medication by the right route. 5. Give medication at the right time. 6. Complete the right documentation. Medication errors, lack of concentration, lack of knowledge, failure to follow correct procedure, poor communication, poor job performance. The first thing you do if you make or discover a medication error is report it. Complete appropriate error report and immediate contact director and send report. Medication